Yes, for the past 2 weeks in the UK and more recently in the US, we launched the COVID symptom tracker app, which is on every mobile phone. You just download it, and we managed to get, after just a couple of weeks, 2 million people in the UK to use it, and it's one of the fastest selling free apps, health apps ever in Europe, and this has allowed us really to see a much wider range of the virus than is reported in the media, which mainly focuses on hospital cases and deaths. And this has given us a spectrum of symptoms that are out there that aren't recorded, things like loss of taste and really severe fatigue that a lot of people report. And so we're adding new symptoms to the list. We're also able to track over time what's happening to the virus in the population in ways that we can't do just by looking at hospital data. And this is giving us a very different picture.
Tim, there's been many conversations behind the scenes to try and reopen economies, and there's a feeling that if you conduct some coronavirus testing, if you take temperatures, use masks, there might be a way of fighting coronavirus to allow economies to return to some semblance of normality. But what has been one of the variables here is the asymptomatic cases where you cannot detect any sign of COVID-19. What do you make of that and the challenges as we look to reopen economies?
Well, I think there's not much we can do about asymptomatic cases until everybody's tested. But if you look at the symptomatic cases, we estimate at its peak in the UK, we had about 2 million people, we estimated, extrapolating from the 400,000 that had symptoms to the UK population, and similarly be in the US. So if we know that, say, 4% of the population affected, and we know that on top of that, the latest results coming out, for example, out of New York yesterday in pregnant women suggested that it was about 8 times more people who have asymptomatic disease than symptomatic. You can then say, take your 2 million and you just say, well, okay, there's another 16 million on top of that. That gives you an idea of how many people have already been affected, which is likely to act as some form of buffer against the second wave of infection. And I think we really need to get to grips now with not just talking about this small, unfortunate group of people in the hospitals, but in terms of the epidemiology, talk about how many people have actually already been affected and will have at least, we believe, some temporary immunity against the next wave. And so I think it's this shift into understanding the population that's really important.
Hi, I'm Joanna Bersecci, and thank you for watching. You can check out more of our videos by clicking on the boxes on the screen. And don't forget to subscribe to our channel for more from CNBC International. Thank you for watching.